first question I think I'm going to ask to our panelists is a question that came from Abdu, and it was around community engagement and targeting. So Abdu said that community sometimes has a narrow understanding of targeting, and for them it can just be a reduction or a cut of assistance. So do we have tools to correct such a misunderstanding, thinking about communication tools that we may have? So we do have an AAP officer in the hub who's actually working on this. Unfortunately, he's in a different time zone, so he couldn't join this. So I don't know if any of the panelists want to answer this question from Abdu on the tools.
Yeah, I can jump in. So within WFP, we have various guidances relating to the various aspects of programming, and we incorporate the community engagement and the AAP element into those various guidance, in addition to having specific guidance on AAP and community engagement. So yeah, there are various tools available. The important stages are to understand where the confusion is lying in, what the current understanding is, and just to ensure that the communications are clear and informed, and really are articulated to in a way that can be received and understood. We see a lot with AAP that expectation management is a really big part of managing trust and managing mistrust. And so the understanding what the expectations are around a targeting process, managing those expectations will be really important to building trust. So I can't speak about UNHCR's tools, but WFP, we certainly have guidance on this area, which we'd be happy to share. Thank you.
Okay, great. Thank you for that, Charlotte. We're also working on some tools within the hub to support country offices. In terms of, there was an additional question on the use of progress by one colleague who was asking whether this is from Ben, and he's saying previously it was stated not to use status as a form of targeting. But if the data comes from progress, does it not de facto only target populations seeking asylum? So I can see Annika is already ready to answer that one. So I'm just going to put you live, Annika, to address that question from Ben.
Yeah, sure. Yeah, I mean, obviously, if we're using data from progress, this would be refugees, which are in our progress database. But my point was that then we would just say that one criteria is status, and then everybody would get assisted, right? So just because they're refugees, it doesn't mean that they should be assisted. They may not have those needs. Maybe they have income, maybe they have a job. It was more of that. But also, I think, you know, we often work in mixed settings. We work a lot with IDPs. We work with a lot of other persons of concern. So progress is not the only sort of database that we will derive data from if we are targeting people beyond refugees. So I hope that clarified my point. Over. Emmanuel, you're on mute.
Thanks for that. Yeah, so there was an additional question from Ben, which was how to reconcile school-based programs, which both the WFP and UNHCR undertake, and targeting as suggested there in the presentation by Cinzia. So everything that's being said about targeting is great, is what Ben is saying. He's saying, but all school-based programs essentially support the least vulnerable, as the most vulnerable are often out of school, child labour, etc. So how do we reconcile this issue? So does anybody want to take that question from our panelists? Yeah, Cinzia?
Yes, maybe I can start and then Claudia can add, or other colleagues if they want can add. You know, these are specific if I understood well the question is a specific question on school feeding programs, and the fact that I would say that school feeding is not the only program that often is implemented, but general food assistance or cash assistance also provided. So the idea and what can guide us in identifying the children that are out of school is really through the assessment, and have specific assessment that identify this household. So if they are not included in the specific school-related program, they can be assisted as identified as vulnerable to be assisted by food assistance or cash-based assistance if needed. I'm not sure if Claudia wants to add on this, or Annika.
Any additional comments from Annika and Claudia on that? No? Okay. So we'll go to another question here, which is well, just a statement that comes from one of our colleagues, just to mention that the Hub is developing an AAP toolkit for targeting, including for the consultation process and key messages for the countries that we're working with, and that will be available more broadly for country offices. So just to let you know that that's coming. There's an additional question here from Francis, who asks, in the context of camp-based refugees, who is considered as the community to be consulted for targeting? So Chinzia, I've left you up on the screen, so you might have been.
I'm not sure if I'm mute or not.
No, you're not muted.
I'm unmuted. No. Yes, I think that there are some leaders also in the refugees camp that can inform. They are usually part of the focus group discussion or key informant interview. So you have different consultation ongoing when we try to involve the community in the targeting. One is like the community leader, but also specific focus group discussion with specific group of refugees that are in need.
Oh, sorry, there's an additional comment here from Annika on this.
Yeah, and I think this is where it goes back to the engagement of relevant staff, right? So the protection people and the community-based protection will be able to say we need really to have a specific women's group, we need to consult the host community, we need to consult X, Y, and Z. So I think that is also a part of sort of the multifunctional team approach, but also including then staff who are working with communities. Over.
Great, thanks for that. We also have an additional question here around the fact that targeting requires time and money. So who's going to play the decision? Who's going to be the decision makers when it comes to choosing to target or not? When it comes to whether we do that or not? So does anybody want to take that question?
I can, Emmanuel.
Okay, great. Thanks, Valerie.
That's a very good question, and I think it's something that we always have to do, is to look at the cost of an exercise versus what it will get us. But I think that as our principles and as our agreements are to target those based on need, this is something that we should be considering everywhere, recognizing that our global funds for assisting refugees is going down as the needs are increasing. So I really think that we should be considering targeting everywhere, recognizing that there might be an upfront cost in developing a strategy. However, recognizing that this will result in those who are in need of assistance getting the assistance that they need. When prioritization has to come into play, given that the approaches and the guidance are very similar for targeting and prioritization, having thought through the targeting process is much easier to prioritize once you have done some of the steps that Chinzia outlined in terms of the analysis and looking at the vulnerabilities. So starting with that, and then if faced with prioritization, it is an easier exercise, which often has to come quickly because funding often gets cut or there are gaps in funding. So I think looking at that holistically. And just to add on that, I would say that there is a strong push, we know, from donors to target assistance based on need and to consider how we jointly program together more longer term. So I would say that there would be more consideration for immediate funding to meet basic needs by donors if we are working together and developing and implementing a joint targeted approach. But over to other panelists for...
Great. Thanks, Valerie. I think, Claudia, you also wanted to mention something?
Yes, no, thank you very much. Just to add on to Valerie's point made, which I fully agree with, and I think it's also a little bit linked with the question that we had earlier while Cinzia was presenting on the blanket assistance. Would it be automatic blanket assistance if targeting is not appropriate? So in reality, the situation is that we often find ourselves in the situation, especially in protected refugee crisis, where funding becomes an issue, not all, at one point in time at least. So in that sense, it's very important that we have the right systems and information in place in order to be prepared when this happens. So certainly investments are very important. Just to mention then, is the answer automatically when assistance, when targeting is not appropriate to move to blanket? Very much, like in theory, yes, but when it comes to these funding shortfalls, we often have no choice. And then there are different. What are then the different options that we have? One option is to reduce transfer values. One option is to reduce the number of people assisted, and a third one would be, in theory at least, to look at the duration of assistance as well, to have some kind of time factor. So that's what the three options that are typically considered in any humanitarian assistance operation. But we sometimes think that reducing the transfer value is the fairest option, and I just want to highlight that that is not necessarily the case, because there are different needs, and we have to be very much aware of who has different needs and also different requirements to have their needs met through assistance. So that's so it's very context specific, and unfortunately there is not like one answer to that fits into all different contexts.
Thanks so much for that, Claudia. There was a question here on the guidance and whether it includes any recommendations for ensuring inclusiveness or transparency when it comes to community-based targeting. So I don't know if anybody wants to take that question on the guidance and inclusiveness, transparency in community-based targeting.
Yes, it does include that, Emmanuel. And there are also a few field examples that could be helpful. It does go into sort of the community composition and analyzing this and how the decision making is made within the community, and of course the AGD principles, etc. And so I think it does actually address this. Over.
Great, thank you so much. An additional question here on inclusion error. So once the inclusion error has occurred and there are vulnerable people in need of assistance who are not included, what would you advise? So what's the advice when we spot that in terms of inclusion error? So I don't know who wants to take that. Cinzia, you want to take it?
I can try to answer to that. So when we talk about the inclusion error, means that somebody that is not in need is assisted. So it's an error that is pretty much related with the resource used in the wrong way, because maybe there are some people that are in need and are excluded from assistance. So the idea is really to try to reduce the estimation of these errors, but definitely, when we talk about inclusion or exclusion is much more severe, because you have people in need. That's why it's very important that we have appeal mechanism in place that allowed the person in need to appeal to be reintroduced and reintegrated in the assistance. And when there is the CFM in place that is strong and works well, this should be captured through also the complaint and feedback mechanism. But definitely, the appeal system should be in place so the person can appeal, but also, you know, the monitoring is essential in this case to be able to identify, you know, who are the ones that are currently wrongly excluded from assistance. Over.
Great, thank you very much, Cinzia. We also had an additional clarification that was requested when it comes to prioritization and resource constraints, and whether there are any stipulations from donors on which kind of methods to employ. Do we have anybody who wants to address that? So with reference to the question on resources and prioritization, are there any stipulations from donors on which methods to employ?
I can take it, Emmanuel.
Okay, great. Thanks, Valerie.
Sure. In my experience, but others, Claudia particularly, come in here, I have not seen donors pressing for a certain method. What I have seen is donors pressing for a joint approach with a thoughtful method. So, you know, there has been significant pressure for UNHCR and WFP to come together in a joined up approach to targeting assistance to meet the basic needs in several countries. I'm sure many of you have you know, dialogued with donors around this. But in my experience, no, they're not pressing a certain method, but they do want to understand the data, and they want to see the evidence around the vulnerability of the population and why we as agencies feel, you know, who would be eligible for the assistance given the resource constraints and given the situation and the context. So many donors are very interested in the protection elements and the potential impact on the population of targeting assistance to a portion of the population when the full population has received assistance for some time. So very interested in the protection analysis and the protection risks around that, which is a key consideration, obviously, in our joint targeting approaches. And there are key guidance in the joint guidance and also documentation around this. I would say that this some of you've been asking for tools, and it's really interesting to hear and well noted. The guidance is one of them, obviously, and there are several annexes and text boxes within that can be useful. But the hub is developing tools and documenting the learning around this in implementing this in several different countries. So within the next couple months, there will be a joint website launched, and a lot of documentation will be housed there so that you can draw and learn from the experiences in the countries that the hub is currently supporting. Thank you.
Great, thanks, Valerie. Whilst you're up, just a quick question on hub support. There was a question from a colleague who was asking around, does the hub support in non-refugee situations?
Currently, the hub is only supporting in refugee situations. We do recognize that many refugee situations are also mixed situations, and so there is a need to potentially expand that in some places. But the idea was for this initial year to focus on joint operations in refugee settings, but that might expand later if you know, if there's additional support for the hub moving forward. Thanks.
Great, thank you. We have an additional question here on in classical refugee contexts where refugees are receiving assistance. How do we ensure that we demystify targeting from discrimination? For example, are there proxy indicators that can be used to assist one POC over the other should resources be limited? This is an example, a question coming from Kakuma, where they're keen to consider vulnerability-based targeting again, but they're not sure how this will be embraced by the refugee population. So does anybody want to take that question, which was from Ura in Kakuma?
I can take it.
Thanks.
I think that's a very good question, and I think we need to first of all look at, are we talking about targeting or are we talking about prioritization? Because I recall that the initial assessment that was done several years ago in Kakuma showed a very high vulnerability of the population of over 95%, if I remember correctly. And the agreement then was that no, it was not appropriate to target, and so blanket assistance continued. However, with the potential cuts to assistance, I'm not exactly sure how it is in Kakuma right now, but I believe there are some cuts. We might be looking at a prioritization exercise. And if that's the case, then, gathering community acceptance and ownership of the process is crucial. And you asked about an indicator, but I would say I would focus much more on the community understanding of the process and their perceptions of vulnerability, and to see how that correlates with some of the data on the vulnerability. But I would say it's not necessarily one indicator, but more of a process to understand their perceptions and to communicate about the reasons for the exercise, be it targeting based on need or prioritizing based on resource constraints. I hope that answered the question.
Great, thanks so much, Valerie, for that. We have we're at the end of the time. I don't know if we could do maybe one more question or if we should close up. There's one question coming from Andrea. Maybe we'll address this question and then we will close the session. But thanks so much, everybody, for all the questions. If we didn't address them already, we will make sure that we will look at them and we will read through them and try to address them at a later time. So this question is from Andrea, who was asking, in the immediate aftermath of a crisis, humanitarian actors normally start with blanket targeting, or they have local actors who act as gatekeepers to support the targeting. But then when we're moving to out of the acute emergency phase to a more stable, protracted phase, we often see more restricted targeting approaches come in place, which can create tensions and misunderstandings. So the question here is around, right from the beginning, what mitigation measures can be adopted in the first place to avoid any outlying risks that might come from the changes in targeting approach that happen over time? And do the guidelines consider different issues related to targeting in different phases of the response? So I think it's quite an important question to ask, so anybody from the panel would like to take that one.
I can take it. I can start answering. Yeah, thanks. It's a very interesting question. I think that, there are some, as I said before, some evaluation that you need to have and risks that you need to evaluate when you move to targeting. As I said and mentioned often, the community engagement is key, to outline these risks. But really, a risk analysis should be conducted to understand which targeting methods can mitigate these risks. And in terms of different phases of the response, I think that we don't have a specific phase for the response, but definitely, it depends on the operation and the needs, and also the understanding of the needs at the beginning of a crisis, and then towards, the onset of the crisis and when the situation is more protected. So need assessment will inform the needs, the changing of the needs, and based on that also to consider all the factors of the pro and cons of each method, and how to then develop the complete targeting approach. Valerie, you want to add on this?
Actually, it was, just to briefly come in. Yes, so now just to add on to what Cinzia has already said, I think it's a very, very important point. And I think it's something that also we can change a little bit in the way how we move forward, that that from the very beginning, when there is a new refugee situation, that the messages around targeting, needs-based targeting, are communicated really early on, so it doesn't come as a shock out of a sudden. And I think that's one area where we can all improve on. I think there has been already a bit of a change in this sense. I think it's particularly difficult to introduce targeting in a protected crisis where assistance has been provided for many decades. It's quite different. We see also in some countries where we do have new refugee influx vis-a-vis those ones who have been there for longer, that the introduction of targeting processes has to be differently managed. Yeah, so I think it's a very important point. It's indirectly covered in the guidance. I think we are talking about that blanket assistance is often, the most appropriate in the first phase. But yeah, it's not totally detailed out, and maybe that's an area that we could look into in the future